Good evening. Welcome, everybody. Thank you for joining us this evening for the latest in our series of talks from Sightsavers experts on various topics. I'm Mike Strani. I'm the Director of Major Giving at Sightsavers. Some of you will have seen me do this before, the comparing bit. Some of you I'm only just meeting this evening. To start with, a little bit of housekeeping. So there are no fire drills planned this evening. Helen actually told me earlier there are no fires planned this evening. I'm not sure anyone plans a fire except for 5th of November. So there are no fire drills planned this evening. If the fire alarm goes, you just need to walk out of that door, down the stairs because the lifts won't be working, down a convenient 6 floors to the lobby, and out the front door. And the gathering place is where everyone else will be going, so I wouldn't worry too much about that. So that's all the housekeeping, pretty straightforward. So tonight's session will be led by Fatoumata Diouf, who is Sightsavers' relatively new still regional director for West Africa. And her piece tonight will be titled Sightsavers in West Africa, A Fresh Perspective, because Fatoumata joined us just last year. She oversees our work in 14 countries across West Africa, as her job title suggests. Before that, she worked at SOS Children's Villages, and she actually oversaw 18 countries there. So I think she's whittling down to a smaller number of countries, maybe her favourite ones. And she's worked in sort of alternative care, health, education, family strengthening, and emergency response in all sorts of places, including conflict zones in places like the CAR and Niger. And she's worked in the private sector in financial management roles, worked in banks and various multinationals as well as other NGOs too. So I won't keep you any longer because it's Fatoumata who you really want to hear. So without further ado, please give a warm welcome to Fatoumata Diouf.
Ladies and gentlemen, good evening, and thank you very much for making the time to join us tonight. I'm personally honored to have the opportunity to speak before you today, to tell you a bit about myself as well as the work that I do for Sightsavers. My name is Fatoumata Diouf, and I am a Senegalese national. I am married, the mother of 3 children, ages 9, 6, and 3. As far as education is concerned, I have a bachelor's degree in finance from Georgia State University, and I later on pursued an MBA in management from Université Paris-Dauphine in France. As Micah said, I have a pretty diverse professional background. I started working for the banking industry, working for EcoBank as a credit analyst in charge of the institutional portfolio. I later on decided to go into mainstream finance and joined the British American Tobacco, which is a tobacco manufacturing company, holding different roles in finance. In 2013, I decided to go for the INGO sector, have a change of career, and joined the International Food Policy Research Institute, which is a US-based organization working in the area of food security, fighting hunger, malnutrition, and poverty. I left IFPRI to join SOS Children's Villages International as a regional director for finance and control in charge of 18 countries across West and Central Africa. So this is the last position I held before joining Sightsavers. I'm fluent in French, in Wolof and Hausa, which are native West African languages. I speak decent English, I hope. So if I say anything that's not very clear to you, please ask me to repeat myself. I speak basic Spanish as well as Arabic. So I joined Sightsavers in November last year. It's been a year, a very busy year this far, in charge of 14 countries across the region. And those are the ones that you would see on the map here. Hopefully towards the end of this year, we would be moving into expanding into 3 more countries. Niger, Chad, and DRC with our Ascend project, which is an NTD elimination project. So working with Sightsavers across West Africa has been quite interesting. This time last year, I knew very little about eye health or neglected tropical diseases. So I've spent the first year traveling around, visiting our country offices. So a lot of traveling. In fact, I get in trouble with my children because I'm always on the road. But one good thing about me traveling is that it has taught them a lot of geography. Each time I have to go somewhere, I have to show them where it is on the map. I have to tell them a bit about the country. And when I come back, of course, I have to bring them something. Yeah, that's the trade-off. So this past year, as I said, I've traveled a lot. It's one thing to hear about Sightsavers operations or to read about them on the reports. It's another thing to see for myself what the ground realities are, to meet the teams, to visit our partners, to see our projects. It's an experience, a very good one, and I'm glad I've been given this opportunity. So West Africa, what are the changes that we're working to achieve? First of all, Sightsavers is carrying out projects or delivering projects in 4 thematic areas: in eye health, neglected tropical diseases, education, as well as social inclusion. In the area of eye health, the change that we want to see is make sure that quality eye health is a reality and is available to the communities in West Africa. How do we do that? We do it by partnering with the ministries of health to provide them with medication to prevent and treat avoidable blindness. We do it by training the health workers, the human resources in eye health. We train ophthalmologists, we train ophthalmic nurses, we train opticians so that they're able to deliver the service that we expect them to deliver and which the populations in those communities need. We also support with infrastructure. We've built eye clinic across West Africa. Not only have we built them, but we've also equipped them and providing the human resources to support activities in those areas. In terms of neglected tropical diseases, the change that we want to see is to eliminate them from this region. I remember when I first joined Sightsavers, I was discussing with a friend, telling her about this organization where I work for, and telling her about Sightsavers' work. And I remember saying, you know, we're working to eliminate trachoma, river blindness, lymphatic filariasis. And she said, well, so you mean those diseases still exist? I learned about them when I was in school back in the 80s. I'm like, yes. Unfortunately, they still exist. You don't hear about them because they're neglected, but that doesn't mean they're not there, and that doesn't mean that people are not still suffering from them. Change we want to see. Disease elimination, how do we do that? We do it by supporting Ministry of Health again, providing them with the medication to treat, to prevent and treat, but also fighting to eliminate. We have very ambitious neglected tropical diseases program across West Africa, the Accelerate program as well as the Ascend program, and in the medium and long term, we're hoping to be able to push back those diseases out of our communities. In terms of education, change we want to see is make sure children with disabilities have equal access to education. And I think this is the thematic that is closer to my heart, maybe because I'm a mother. Before working for Sightsavers, I did not think it was possible to have children with disabilities learning in mainstream schools amongst children who do not have any disability. I think this is the uniqueness of our approach, putting them together, teaching them inclusion at a very early stage. I didn't think it was possible until I visited an inclusive education school, and I saw children with different types of disabilities, whether it is hearing impairment, visual impairment, physical disabilities, learning alongside with children who do not have any disability. This is the change that we want to see. It's unique, but it's possible. We've done it. We have evidence that it's possible, and now we want to scale up to reach out to more children and to reach out to more communities. In terms of social inclusion, what we want to do is give equal opportunities to people with disabilities. When I say equal opportunity, I mean economic empowerment, but I also mean political participation. In Sierra Leone and in Senegal, we have political participation projects. And what those projects are delivering is making sure that people with disabilities are capacitated to speak for themselves. Whereas in the past, INGOs used to advocate for people with disabilities. I mean, that still happens. What Sightsavers wants to do is make sure people with disabilities can advocate for their own rights, can speak for their own self, and are present in the decision-making instances so that their voices can be heard. So ultimately, what we want to achieve is change within the systems, the health systems, but also the education system. Our project, as you can imagine, are time-bound. We want to ensure that when we exit, governments are ready for the transition. They can take up what we've done and they can scale up to reach out to more people. And this is where our advocacy work comes in. We build a strong connection, strong relationship with government to advocate to them so that they can ensure sustainability after our intervention. So I wanted to share with you here recent achievements in West Africa. Last year, our programs have screened over 441,000 people across the region for visual impairments. We've also delivered 96 million neglected tropical diseases across West Africa. In addition to that, we were able to successfully advocate and obtain the integration of eye health data into the National Health Management Information System. What does that mean? In the past, National Health Management Information System did not capture any data regarding eye health. So we were not able to know how many, well, at the national level, you wouldn't know how many people have been refracted, how many people have had cataract surgeries, how many people have received other types of surgeries, how many people have received spectacles, etc., etc. Through our advocacy, we've seen that change happen. And now, data is not only available at the national level, but that data is disaggregated into gender and age. So as far as country-specific examples are concerned, on the upper level here, we have a celebration ceremony where Sightsavers was opening up a new eye health clinic in northern Liberia. This is one of the most remote locations in Liberia where the needs for eye health services is still quite high, but where government have not invested in providing that service. On the bottom here, we have the representative of the World Health Organization, as well as the Ministry of Health of Ghana, celebrating the elimination of trachoma in Ghana. Yay. So we've done that in Ghana, and we want to replicate it across West Africa. We've also advocated and obtained free eye care services for people with disabilities, both in Sierra Leone and Senegal, through our eye health project, and also obtained, through advocacy again, the inclusion of disability into the national training curriculum for teachers. Because this is a change of paradigm for teachers. In the past, teachers, or up until a very recent time, teachers in mainstream schools used to cater for children who did not have any disability. Now, not only do they teach to children with disabilities, but in the same classroom setting, they would have children with different types of disability. So they need to be trained. They need to be capacitated so that they know how to cater to those different needs. So challenges, as you can imagine, West Africa is one of the most challenging places in the world for many different reasons, but also a very beautiful part of the world. And I invite you to visit when you get a chance. So first of all, the macro context. With the macro context, we can name political instability, which is a strong reality in West Africa, turnover in power, turnover in governments, and each time there is turnover, we have to sort of start from scratch again to build back the relationship with government, to raise awareness as far as our thematic areas are concerned, to advocate so that they can give us the support and the focus that our thematic areas need. If I can just cite the example of Guinea-Bissau. Guinea-Bissau is renowned, I think, for political instability with military coups that are very, very frequent. In fact, as I speak with you today, the president's mandate expired 6 months ago. He's still in power. Elections are planned this year, and there is still a big question mark as to what is going to happen afterwards. So that is one of the realities we have to deal with in West Africa. Making sure that business continues despite political instability and that can be a challenge. Another challenge we've seen increasing in the recent years is security threats due to Islamic groups being present in our region. If I take the cases of northern Burkina Faso, northern Nigeria, northern Cameroon, these are parts of the region where we have operations and where we had to revisit our intervention model and adapt our activities to the ground reality. Because we are a responsible organization, we have a duty of care to our employee, and we do not want to put our partners before any challenging security situation. So in those areas, we've either pulled back or we had to revise our intervention model. Economic challenges as well. If I take the examples of Liberia and Sierra Leone, those are two countries whose currency is pegged to the dollar. And when there is inflation, we would naturally see strikes happening because health workers and teachers would be complaining about the decrease of purchasing power and the high inflation rate generally in the country. So these are challenges that we have to deal with. When there are strikes, it impacts our activities. We, as an organization, we do not implement. We rely on the Ministries of Health and the Ministries of Education to implement our projects on our behalf. So when there is instability among the health workers or the education specialists or workers, then it impacts our activities. And then socio-cultural. I was just saying earlier that we still have a lot of beliefs around some of the diseases that people suffer from in our region. People with disabilities are still seen as witches. They are still seen as people who've been cursed. There is still a lot of stigma around disability, and there is still a lot of beliefs around traditional medication. Recently, I was in Liberia, and I met with an ophthalmologist who was telling me that some people, are still treating conjunctivitis with urine. Why do you do that? How do you do that, right? And we still have to continue raising awareness so that they part from these sort of beliefs and do come to the health facilities when they're sick, when they suffer from those conditions, to receive the treatment that they need. I mentioned the global context as being a challenge because we are a global organization with global standards, with global policies, but we are implementing in local contexts with the ground realities that you see in some of those countries. And sometimes there is a disconnect between the global organization that we have and the local context that we see on the ground. And being able to balance the two can at times be a challenge. Policy environment is also another issue in our region, in a sense that we don't have, in most of the countries, I mean, with Sightsavers intervention, things have changed, but there's still a number of countries where we don't have policy framework for our thematic areas. So national strategic plans for eye health, or national strategic plans for inclusive education, these strategic documents are missing, and it makes the work a bit challenging for us as an organization. Resourcing, both financial resourcing and human resources, are challenges in our region. And you would understand, in countries where malaria still kills many people, in countries where HIV still kills many, where tuberculosis is still a reality, you would understand that government does not give that high of a focus to eye health. I mean, they would tell you, well, you don't die from being blind, right? Blindness does not kill. You would hear things like that. Although blindness does not kill, it has a strong impact on the lives of people who suffer from this condition. When you're blind, in our context, your access to education is limited. Your access to employment is limited. You're stigmatized, right? Within your own community, within your own family. So it has a debilitating effect on the lives of many people, not only them, but also their families and communities. And that's why it needs to be given the attention that is needed to support people who are suffering from these conditions. Human resources is a challenge in a sense that in many of the countries where we're operating, Sightsavers is the only, or one of the only organizations building capacity, training eye health workers, training ophthalmologists. And I can name Sierra Leone as an example where 80% of the eye health workers were trained by Sightsavers. And this is the trend pretty much across many of our countries. Government does not really invest in training the eye health workers. Sightsavers, as I mentioned, is one of the few organizations doing that. So where the needs are big, where the demand is high, and where you have very limited human resources, it makes service delivery a bit of a challenge. Discrimination and stigmatization of people with disabilities. I've touched on it. In some parts of our region, people with disabilities are still seen as people who should not be within our communities, people you don't need to mingle with, people you shouldn't mingle with, because they're cursed, because they're witches, because they have bad luck. So we've done a lot in raising awareness. We've done a lot in sensitizing the communities, but there is a lot that still needs to be done. So what is our focus going forward? Our focus going forward is to make sure that the policy environment is favorable to us as an organization, but also to the people living in those countries. So what we've done is support countries to develop strategic eye health plans, strategic inclusive education plans, because where you have a strategic national plans, a budget gets allocated to that plan, and that budget gets broken down into actions. So when we have national strategic plans, we can be sure of government's engagement and commitment to deliver on the plans. So in Senegal and Sierra Leone, for instance, we are working towards finalizing the National Eye Health Plan as well as the National Inclusive Education Plans. Our focus is also to continue supporting our NTD project to ensure disease elimination. We have a target, 2025, to eliminate trachoma, lymphatic filariasis, and we hope that by this date we will be able to say these diseases no longer exist. Our focus is also to reduce prevalence of avoidable blindness by providing treatments, by training eye health workers so that they are capacitated to deliver service in country. We have a strong focus on resource mobilization for eye health. Why? I've touched on it earlier. Eye health does not get the priority that it needs. Government will not fund eye health when they're burdened with malaria, burdened with HIV and the likes. And there are very few organizations that are intervening in this domain, and raising money for eye health has been a challenge for our organization. We're championing global agendas, whether it is the UN CRPD, the Sustainable Development Goals, the Global Disability Summit, just making sure that we're promoting these agendas so that people with disabilities have equal rights and opportunities. We want to foster regional exchanges. I mean, if you're thinking about neglected tropical diseases in a country like Guinea-Bissau, and you want to treat it and you want to eliminate it, you have to make sure that your intervention goes beyond Guinea-Bissau, but also to the neighboring countries, because of the impact migration has on these diseases. People migrate within this region. So you have to have a cross-border approach to elimination. You have to make sure that the countries speak to each other so that together they can achieve this elimination target. I wanted to share with you the story of this young boy. His name is Eric. I met him in August when I visited Sierra Leone. So I was visiting an eye health clinic in the northern part of the country when he was brought in by his uncle, the gentleman in the red shirt. He brought him in saying that he was hurt while farming. So what happened is his friend accidentally hit him with a knife in the eye. When he brought him in, the ophthalmic nurse that you're seeing here immediately examined him and determined that the trauma was too severe to be handled in a primary healthcare facility. So he was transferred to a tertiary care clinic in a region 4 hours away from where we were. And this is a facility that was built by Sightsavers, built and equipped by Sightsavers. By the time he got there, the trauma had become very serious, and he had already lost his eye, his right eye, that is. We couldn't save the eye, but we at least ensured that he received the treatment that he needed, but also the counseling that him and his family needed. And the whole time I was there and seeing the situation, I kept on asking myself, what would have happened to him and people like him if Sightsavers was not in this location? If we hadn't invested into eye health? If we hadn't built these infrastructures, what would have happened to him? It's sad that we couldn't save his eye, but what we could do and what we have committed to doing is supporting him so that despite his disability, which is a new condition to him, he's able to have access to education. And this is one of the reasons why I'm so excited to work for Sightsavers, because we make an impact. We have a positive impact, positive and lasting impact on the lives of many people across West Africa. I'm pleased, very happy to work with very knowledgeable. Everybody in his domain is just an expert. Sightsavers. People I work with are very knowledgeable, they're hardworking, they're committed, they're dedicated, and most importantly, they're the nicest people I've met. I've been in the organization for just a year now, and I've learned so much in just 1 year working with these people. I'm excited to work for Sightsavers because our work is evidence-based. These are just not statements that you put on paper. I'm able to tell you what we've done, how many people we've reached, where we've made an impact, how much it has cost, with evidence, with numbers. Having the opportunity to work multi-country is something I'm very happy about. So I get to see these realities not just in one country, but in 14 countries. And being able to take the best experiences in one country and replicate them elsewhere is actually a very good thing. I like the fact that we have a multi-thematic approach. So I'm just not working in the area of health, but also in education, in social inclusion, which broadened my horizon as a professional. And finally, I like the fact that Sightsavers not only provides treatment for these diseases, but is also committed to eliminating them. And knowing that we're working towards pushing back these diseases out of our communities, this is something that is mind-blowing to me. So 20 years from now, I would be able to tell my grandchildren or my grown children, I was part of the team that eradicated trachoma, river blindness, lymphatic filariasis, and that's something I take much pride in. And if we've been able to have impact and demonstrate it, this is because of the support that you have provided. So from all the people in West Africa, I would like to say thank you for the support you provide to our organization. Thank you for taking the time to come and listen to me today. And please, I will pause here and take any question that you may have.
Thank you, Fatoumata. Wonderful, as we all expected. Does anybody have any questions they'd like to ask Fatoumata? Yes.
Thank you. Can you hear me?
Yeah.
Great. What a very compelling presentation. Thank you very much for that.
Thank you.
Just one of the things I found to be quite good about the way in which you presented is your focus on evidence-based outcomes. And one of the things I was struck by is that governments are allocating resource towards HIV, malaria, worthy causes, understandable, but I was curious to see if you've tried to measure the economic impact of curing someone of blindness, just to give governments perhaps more of an incentive to think about, well, a person with HIV may actually be contributing to the economy in a certain way, and then will cease to as they get more sick. Whereas a person who's blind, there's a step function in terms of the impact that has, and their ability to be educated materially increases the human capital they have on the forward. That's one question. And the second question is just, given that you are dealing with, in West Africa, unfortunately, a good degree of stewardship issues in terms of government stewardship issues, and you do rely on the governments to implement some of the programs, how do you actually measure where your money's going? How do you actually measure the impact that you're having? Do you have independent data gathering, or how do you frame that problem to avoid corruption? Thank you.
I think I'll just answer this. So, to the first question, we've been successful in advocating to governments to pay more attention or to give more focus to eye health. And in Nigeria, for instance, we exited 3 regions in the recent years, and we've gone back to see what has happened since then. What happened was that government did allocate some money, quite insignificant in our view, but that was a first step, allocating money to ensure that service delivery was maintained and to be able to sustain the programs, to be able to deliver the quality eye care, and to be able to train the human resources. We've done it in Nigeria. Also in Côte d'Ivoire last year, and through the advocacy of Sightsavers, government did allocate a budget line to fight neglected tropical diseases in the amount of £70,000 per year. So this is to say that this is an ongoing process, and we have to keep on talking to government. We have to keep on raising awareness. We have to keep on advocating for them to continue supporting these diseases that we're working on. Evidence is there. Although blindness does not kill, the impact to the person and also to his family and community. You have to understand that a person that is blind in our part of the world impacts his children, his family, his community, because you would see blind people in the streets and they're begging and their children are there to guard them along the road. So while this child should have been in the classroom learning, he's outside in the streets helping his father or his mother to beg. So evidence is there to show the impact on communities. It's just that, unfortunately, resources are scarce. In our side of the world, government cannot cover everything, although they have the will. Money is an issue. We have to keep advocating, and we also have to keep supporting in providing resources as much as possible to address those issues.
I think, there is some good economic productivity data out there, actually. So, the WHO quote a stat around cataract surgery that is, in the year after cataract surgery, somebody's economic productivity goes up 1,500%. It's kind of a meaningless number, really, 50, it's mad, really. But essentially what it means is they go from not being able to work to being able to work. And if you may have seen the World Report on Vision came out from WHO last week. I'd urge you all to have a look through that. It's not as dry as it sounds. The exec summary is great, but that contains quite a bit of stuff around losses in economic productivity and that sort of thing, and the cost that WHO would estimate to do things like eliminate the cataract backlog globally versus the loss in economic productivity across a number of countries. So there is evidence out there, actually. But part of what Sightsavers needs to do is build a more robust evidence base. If you look more broadly across disability, there is really poor data, actually, around the disaggregation by disability in particular. So a lot of our programs now are building baselines for those kind of things. So in some areas, we've got some pretty good ideas. In others, we're trying to build that evidence base right now to inform what we do in the future. Sorry, there was a second question, I think, wasn't there?
It was so long. It was with respect to how you track. You addressed the issue in terms of how you track where the money's flowing and deal with corruption. I think the example you gave was Nigeria and how you allocated, step back, solve the discussion.
Yes.
Yes, could I ask a follow-up question to the last one, which is, does Sightsavers keep any indicators of comparative performance of the countries in West Africa in terms of their baseline position in eye health, the amount of effort that governments of individual countries are putting into dealing with this, and your own proportionate efforts in each country? And if you do this, how on earth do you go about allocating your budget?
So yes, we keep track of how much government is investing. As I mentioned, it's only until very recently that government started to allocate budget lines to support eye health. Nigeria is one example, and this is one out of 14 countries. So this is to say that government does not do much in terms of allocating resources, financial resources, but they do provide with human resources. They provide the human resources, we train them. So I think this is the trade-off. But in terms of allocating budget line, this is a new trend. This is something that we're advocating for, because what we want ultimately is systemic change. We want sustainability, because eventually and at some point, Sightsavers is going to pull out, and we want to make sure that when we do pull out, service delivery is still there for the communities where we're working.
I think in terms of how we sort of allocate our own budgets, it's kind of a function of both the need in an area and a realistic ability of being able to do something about it, a realistic prospect of being able to actually have some impact. Because there are places where the system is incredibly weak. So we could pour an awful lot of money into something that might only yield a marginal sort of impact. So we have to be quite, we have to be rigorous about the way we do our budgeting, and we have to be sometimes hard-hearted about it, frankly, to make sure that we are having the biggest possible impact. But it's it's an ongoing question that we ask ourselves all the time. Where should we be allocating our money in order to have the most impact? And that's why we have to be so evidence-based. That's the only rational way to do it. I mean, that's a WHO stat. It's not ours. It's not from the Sightsavers program. I'd have to go and look at where it came from. To be honest, it's a bit of an old stat, to be honest. But I mean, our impact is quite dependent on local context and on the type of program it is. So the impact you're going to have through a program that's very human resource focused is quite different from an NTD program where you're talking about numbers of people treated and driving down the rate of infection of a disease. Again, you're talking about something quite different if you talk about education programs. So we've gone through quite an interesting shift, actually. When Fatoumata was talking about the adding into a sort of teacher training curriculum of having disability sort of included, years ago, Sightsavers kind of ran sort of essentially bums on seats kind of programs to get blind children into mainstream schools. And we measured ourselves on how many kids did we manage to get into schools in this area. The change there really, and what we're measuring now is, well, can we create more of a systemic change that is about change, for the future, for the long term, because teachers who will have a long career will be trained in how to cope with children in the classroom with disabilities, rather than running a 3-year program, kind of getting bums on seats. Hope that makes sense.
Thank you. I'll actually dispense with it just because of the science. Thank you for the presentation. It was immensely heartening and insightful. But my question goes to actually some of the eye conditions which you didn't happen to mention, Fatoumata. So I appreciate you talked about river blindness and trachoma. Is there any initiative in respect of cataract surgery, for example, or ophthalmic training? I appreciate that these have been very successful programs elsewhere in Sightsavers remit, and I was just wondering what opportunities existed to explore them in West Africa.
So we carry a lot of cataract surgeries across the region, cataract being one of the major causes of avoidable blindness in the region. So this is part of our eye health project, our eye health program, and we trained human resources in country so that they're able to carry out those surgeries in the case of complicated cases. So yes, we do cater for cataract surgeries in country, and we also do build capacity to make sure that people are able to deliver on those services. What was the second question, sorry? Ophthalmic training. Mm-hmm. Absolutely, and we have that just about in every country. We train in cataract surgeons. So on top of training ophthalmologists and ophthalmic nurses, we also train cataract surgeons who specifically conduct cataract surgeries on the patient. So we have 2 schools within the region. One is in Guinea, Conakry, the DESO school, where people are trained to become certified cataract surgeons. There is also a school in the Gambia, which was funded by Prince Zayed Foundation. So this is where we send our Anglophone students to go obtain certification for cataract surgeries. So beyond the region, people are also sent in Asia and India, that is, so that they can get the training to become certified cataract surgeons. So there are different programs for different people based on the language and based on the experience to seek training for cataract surgeries.
So just to follow up on that, in the Gambia, what is Sightsavers' role? Is it that they provide sponsorship or scholarship or subsidize the attendance of the students, whereas they actually built the educational training facility in the other country? I can't actually remember which one it was.
Sorry, my answer was not clear. So the school was built by Prince Zayed, and what Sightsavers does is provide scholarships for students to attend the program. So we work with the ministries of health in the different countries across the region for them to identify students who would be nominated to partake in this training program. So again, both in Gambia, and in Guinea, do we have such programs in West Africa?
So what you do in lots of places in reality is, sorry, I keep jumping in, I can't help myself. Like this in meetings. What you tend to do is you do something they call a RAB, which is a rapid assessment of avoidable blindness. So basically it's kind of a survey looking at what's the need, what are the conditions that are most prevalent, what's the system like that's supposed to address them. And then Sightsavers' methodology really is to address those things. So in lots of places, as Fatoumata says, human resources is the key issue. So training people is a big deal. On the kind of disease-specific stuff, what we're really trying to do is treat those conditions that people present with in the biggest numbers really first, because so that's things like cataract. So that's why you see in our outputs there's loads of people having cataract surgery, because it's the biggest thing that the most people present with. But our aim really is to offer comprehensive eye health programming and support comprehensive eye health programming. So whatever people present with when they turn up at the primary health centre, they're able to either be treated there and then, or they get referred on to somewhere else to be treated for the condition they have. Now, in reality, that's more difficult for some conditions than others. So if you take something like cataract, relatively straightforward, relatively transactional thing to do. They get, picked up, taken to the hospital, have surgery the next day, they go home the day after that, the bandages come off, they can see again. Close to a miracle as you're ever likely to see, done. And they may turn up for their follow-up, which is what we try and get them to do, or they may not. But by and large, the job is sort of done by the surgery. Compare that to something like glaucoma, which is harder to diagnose to start with. It's a lifelong condition that people have got to live with, and if they're on medication for life, they're not going to see any improvement in their eyesight. All that's actually going to happen is their eyesight won't deteriorate any further. So you don't see the transformational impacts. So people kind of think, well, after 6 weeks, they think, well, I'll stop taking that because my eyesight isn't getting better. So they have to be sensitized to be made to understand that it's about prevention rather than cure or restoration of sight. So what we're trying to do in some places is we're trying to build specific modules and specific elements of components of programs that will address some of those more challenging things. So for example, in Nigeria, we've just launched a pilot program, which is funded by Allergan, the pharmaceutical company, who conveniently make glaucoma medication. They're funding a pilot program to try and address glaucoma in the sort of rural area that surrounds the capital. And that's a program we're aiming to expand with them. And we've come up with specific interventions that are about identifying the risk factors for people with glaucoma. Who are they likely to be? And then how can we actually refer those people on and get them through the system and get them to either accept surgery or be willing to take this medication that they may be on for some time, and to do the behaviour change bit to get them to understand that that's a long-term gain. Yeah. Sorry, long answer.
Do you go around schools educating children about the symptoms or what could be happening, and as a result, either within their family or their village, they could actually pick up things and start networking, communicating. Because I think a lot of the problems you face is actually identification, and then rectification follows on from that.
Thank you for asking the question. That's a very good one. Yes, we do raise awareness amongst school children, but also with the Mothers Club. So what we've done with our education program is we have Mothers Clubs that are formed in those schools, and we train them to be able to detect some of these issues, some of these refractive problems with children, and to be able to flag them as early as possible. So we also train teachers, because I think they're one of the first that see that a child is having visual impairment. So the screening starts with the teachers. They're trained to be able to identify refractive errors among school children. We also train the Mothers Club so that they're able to see it and flag it. But children are also sensitized. We raise awareness among them so that they're able to come and speak for themselves and talk about issues they're facing as far as vision is concerned. There was a question there.
First, again, kind of huge thank you, because it's really wonderful to kind of see your ambitions. And with that, I think the holistic piece is really exciting and really ambitious. And I guess I'm just kind of curious as to whether you're partnering with specialists, because if you're looking at kind of changing education systems and systemic change, and also trying to empower people economically who are suffering from visual impairment, I'd imagine that other organisations kind of working towards similar goals, and I'm curious to see how you're kind of working with those other partners.
So in country, what we do is partner with the Ministry of Health, Ministry of Education, but also Ministry of Social Affairs, so that they can have a framework that is favourable to people with disabilities, that is favourable to children with disabilities. We also have partnership with other INGOs in our areas of intervention, so that we can join hands together in delivering the promise that we've made to these people. So Mike, in terms of...
yeah, I mean, there are very few people, I would suggest, in the eye health space or in NTDs that we don't work very closely with, to be honest. And it's only because they're awful people. No, I'm just kidding. But everything we do is very collegiate and collaborative, actually. NTDs is really, really collaborative. So we work in consortia on a lot of the really big programs. We're kind of fitting together a jigsaw puzzle where we are, some of the pieces are Sightsavers and some of the pieces are Orbis or Fred Hollow's Foundation or other people, other experts in the sorts of things we do. We work with technical partners at the same time as well, so the Liverpool School of Tropical Hygiene and the London School of Hygiene and Tropical Medicine. I always get those two confused, but they're both called something like that. We work with them, and they're academics who are offering technical expertise to really, really big programs. So I think it's perhaps unusual in the charity space to some extent. I think people who have, are used to the UK charity space see a lot of charities sort of, there's a lot of kind of elbows for funding and that sort of thing. In lots of the areas where we work, that isn't really the case. We're fundraisers, we are quite competitive, but we work very closely with our counterparts in those other organisations. And programmatically, none of the programs would work, frankly, if Sightsavers tried to just go and do its own thing. It's all really, really about who we work with and the quality of those relationships and the quality of those partnerships. That's why we're as good as we are at anything, frankly, is the relationships we have with people who are really smart and really know what they're doing and working together. Okay, any more questions? No? Oh, there's one from Ersten. You work for Sightsavers, Ersten. You're not supposed to.
Yeah, but I'm new as well, so I had to learn.
He's new.
And I'm from Norway.
Yeah, he's new and he's Norwegian.
I'm curious if money wasn't really an issue, if you had the funds you would like, sort of. Thinking 5 to 10 years ahead, what would Sightsavers like to do? What would you like to see in your region?
I think we will definitely expand on our eye health work. If money wasn't an issue, we would eliminate neglected tropical diseases. We've had significant funding last year and this year to push back on those diseases through Accelerate and Ascend. So we want to believe that NTDs would be taken care of and we would be left with eye health. We would scale up intervention, make sure we reach the furthest behind, we reach the locations that are really hard to reach, and we extend service to communities who this far have not had the opportunity to have, let's say, tertiary eye health clinics within those regions. I think education is also an area where we would want to scale up. For now, our projects are in a pilot stage as far as pan-disability approach to inclusive education. These are new thematics in our region. And from a recent visit in Sierra Leone and hearing from our beneficiaries and hearing from the Mothers Club, one thing they were telling me was that there are more children back there who do not have access to these schools. So this is to say there are still many people, many children with disabilities who do not have access to education, who are not given this opportunity. So if we were to have more funding, one, we would invest into eye health, scaling up, and two, into education.
Thank you. Anyone else, or are we done with questions? Good. Thank you very much. Very insightful questions. And thanks again to Fatoumata. If we could have another hand for our wonderful speaker.
Thank you for having me.
So usually at this point in proceedings, it would just be me saying, thank you all for coming. There are more drinks, so please don't go yet. But tonight we're very lucky, actually, to have, we've got a few of our wonderful trustees who many of you will have met before and some of you might be meeting for the first time. But we're particularly lucky to have the new chair of Sightsavers Board of Trustees, who started as chair in July, although he'd been with us a little bit before that. He is a veteran broadcaster, is the way that his biog always seems to read. But I think he's still, he's still very much active. A veteran makes it sound like he might be finishing sometime soon, but I don't think that's the case. So it gives me great pleasure to introduce Sir Clive Jones, who is the chair of the Board of Trustees of Sightsavers. Clive has held all sorts of interesting positions in the news media. He was CEO of Carlton Television and of Central Television. He's had all sorts of really interesting jobs at ITV. He's the chair of the National Theatre of Wales. He was until recently chair of the Disasters Emergency Committee and all sorts of other things that, frankly, I don't know how he finds the time to do. So if you could please give a warm welcome to Sir Clive Jones, the Chair of Trustees.
Thank you for that welcome, Mike. I'm delighted to be here. In fact, there are three trustees here. There is our vice chairman and our treasurer, so you can ask detailed questions, not only about our finances, but also about our governance. I'm an even sort of newcomer to Sightsavers than Fatoumata. I think you've heard tonight why all the trustees are delighted to work for Sightsavers, because we get the fantastic opportunities to work with wonderful people doing wonderful work on the ground like Fatoumata. And a great big thank you to you, Fatoumata, for giving up how she does it, how she splits her life between raising 3 small children, looking after her family and working across 14 countries and delivering such inspirational work. I do not know, but we're delighted to have her, and long may she continue to work for us. The other big thank you I want to make is to you. We've been very lucky in the last year that despite the fact that Britain doesn't seem to have a government anymore, we've been able to attract hundreds of millions of pounds from DFID to support our work in West Africa, all over Africa, across the Middle East, the Far East and India. And we're very grateful for DFID for doing that. Plus the big international charities like Gates, who got behind our big programs on NTDs. But for decades upon decades, we've relied on you, individual supporters, smaller trusts, medium-sized foundations, and other organizations to fund our basic work. We couldn't do the crucial work that we do without your help and support.
We are enormously grateful for it, and we would be very grateful if you could continue to provide that support. There are long-established donors with us tonight. There are newer donors. There are people who haven't donated yet. We would like to encourage you to do it, and we will go around and try and charm you in every way that you can. And the Treasurer has promised not to twist any arms whatsoever. We're on a journey. It's a journey that's going to last a very long time. But we are, with the other organizations that Mike's described, our other partners, whether they're academics, whether they're medical staff, whether there are fellow organizations coming out of other parts of the world, we have the opportunity of eliminating 2 or 3 crucial NTDs within 4, 5, 6 years. With your help, we can do that, and we would love to do it. Our work will not be over, as Fatoumata has described, just because you've solved trachoma. I remember trachoma was a major problem in the UK. Moorfields was set up to solve trachoma. Wordsworth, one of our great poets, had trachoma. It's our duty to help other countries in the world eradicate this terrible problem. But there is continuing work to be had around disability, around cataracts, around solving refractive problems. We've been able to come as far as we have because of you. Thank you for your support, and we hope you will keep on giving and keep on helping Fatoumata and her team in West Africa and in other parts of the world deliver for the people who deserve it. Thank you very much indeed.
Thank you, Clive. So it just remains for me to say the bar is still open. So we've got the room till 9 o'clock, so please feel free to stick around for a while, have a drink, have a chat with Clive and our other wonderful trustees and our staff who are here, and each other. That would be good. So yes, please enjoy, and thanks again for